Darvat naramkan eorachiyangachai. Darvat naramkan
Hello and welcome to the Alaska Directly Observed Therapy training video. You are viewing this video because you have agreed to be a Directly Observed Therapy Aide, otherwise known as a DOT aide. DOT aides play a very important role in keeping their communities safe from tuberculosis, otherwise known as TB. By now, you should have received a copy of the DOT manual. This was developed by Alaska Public Health Nurses and the Alaska TB Program. In addition to watching this video, you will need to review the manual. Let's start by learning a little more about TB. TB is a disease caused by a bacteria or germ that is spread through the air from person to person. TB is spread in small droplets of spit when a person coughs, sings, or sneezes. If a person breathes in the TB germs, they may become sick with TB. TB usually affects the lungs, but it can also affect other parts of the body, such as the brain, kidneys, or bones. TB is really common. It is estimated that 1/3 of the world's population is infected with TB. It's important to remember that there are two types of TB: latent TB infection and active TB disease. As you can see from this diagram, the person with latent TB infection is healthy. They had a positive TB skin test or blood test. They have TB germs in their body, but the germs are sleeping and not making them sick. People with latent TB infection do not have TB symptoms. Their chest X-ray looks normal, and they are not contagious, meaning that they can't spread TB to others. A person with active TB disease has TB germs in their body that are awake and making them sick. They may have symptoms of TB, and their chest X-ray may be abnormal. They may also be contagious, meaning that they might be able to spread TB to others. Now let's talk about the symptoms of TB. People with active TB disease may have one or more of the following symptoms: coughing that lasts for 3 or more weeks, coughing up blood, chest pain or pain with breathing and coughing, unintentional weight loss, fatigue or feeling tired all the time, fever, or night sweats. Remember, people with latent TB infection do not have any symptoms. You may be wondering, can TB be treated? And the short answer is yes, TB is treatable and curable. If a person has latent TB infection, the doctor may prescribe medication to kill the TB germs and prevent the person from becoming sick with active TB disease in the future. People with latent TB infection usually take 1 to 2 different medications for 3 to 9 months. People with active TB disease must take treatment so that they don't become very sick and spread TB to others. They take several medications, usually for 6 to 9 months, although some people do need to take medication for longer. In Alaska, anyone with active TB disease of the lungs must take their medication by Directly Observed Therapy, or DOT. That is why you, as DOT aides, are so important. Now that you know a little more about TB and TB treatment, let's start talking about Directly Observed Therapy, or DOT. The basic definition of DOT is watching clients swallow each dose of TB medication. The DOT aide brings TB medication to the client and watches them swallow all of the pills. DOT is a program that helps cure TB. The job of a trained DOT aide is to meet with clients to help with their TB medication, to provide education, and to support them throughout their treatment. DOT has proven to help people successfully complete TB treatment. This prevents drug resistance and the spread of TB. Now let's talk about what DOT aides do for their clients. First, they deliver each dose of medication to their client. If they don't watch their client swallow the medication, the dose will not count. Next, the DOT aide asks the client about medication side effects before they swallow the medication. Then they document that the medications were observed. And finally, the DOT aide maintains regular communication with the public health nurse. Before we go any further, let's watch a video of a simulated DOT visit. In this scene, our DOT aide and client are meeting to discuss the plan for DOT. You will notice that this visit takes place in a home, but you can do DOT anywhere that is acceptable to the client, the family, and you, the DOT aide.
Hi Juanita, my name is Evelina and I'll be your DOT aide. The state hired me to be your DOT aide to take your TB medication. Anyone that has active TB needs a DOT aide. And it's really important that you take the medications. If you're going to be out of town or traveling, you need to let me know. Do you have any questions?
No, I understand.
Your doctor wants you to take the TB medications 2 times a week. I'll keep the medication at my home, but I want to know if you want to meet here at your house or if you want to come to my house.
I would like to do it here at my house.
All right, that sounds good. Do you want to meet in the morning or in the afternoon?
I prefer the morning so I can have my breakfast after I have the medications.
That sounds good. I'll meet you on Mondays and Thursdays in the morning. It's important that you give me a call if you make other changes or different plans. You can give me a call.
Okay, I will let you know.
Now let's talk about TB medication side effects. The potential medication side effects are right on the top of the DOT calendar. It is important for you to ask your client about TB medication side effects before they swallow the medications. It is also important to remember that some side effects are normal. For example, the rifampin medication causes orange body fluids. Tears, spit, and urine can all turn orange. A real and potentially dangerous side effect would be dark or Coca-Cola colored urine. Let's watch the next scene from our DOT visit, where the DOT aide asks her client about medication side effects.
Okay, Juanita, now that we have a plan for your DOT, I need to ask you a couple of questions for medication side effects. Are you having any weight loss or loss of appetite?
No, I'm doing well.
Are you having yellowing of your eyes or your skin?
No.
Are you having any stomach aches?
No.
Have you noticed any dark urine?
No, it just turns a little orange, but you said that was normal.
Yeah, that's correct. It's normal. Rifampin turns your pee orange. Have you been feeling tired or fatigued?
No.
How about any tingling in your hands or your feet?
No, only when my hands are dry and then I'm lotion.
Have you noticed any vision changes?
No.
Okay, great. Now we know that it's safe for you to take the medicines.
That looked pretty easy, right? But you may be wondering, what should I do if my client reports medication side effects? Let's watch the next scene to see how our DOT aide handles it when her client reports potentially serious medication side effects.
Okay, Juanita, now that we have a plan for DOT, I'm going to ask you some side effects of the medications before you start the medicines. Are you having any loss of appetite?
Yes, a little.
I don't feel like eating as much. Are you having any yellowing of your skin or your eyes?
No.
Any nausea or vomiting?
Yes, I vomited since my last dose and I feel sick to my stomach.
You're telling me some signs of medication side effects that can be serious. Why don't we call the public health nurse and see what they say?
Okay.
In addition to calling when the client reports medication side effects, there are other times when you should call the public health nurse. You should call when the client misses 2 or more doses of medication in a row, or is missing from the village. Also call when the client is contagious and is seen in public spaces without a mask. Remember, not everyone with active TB disease is contagious. Your public health nurse will let you know if your client needs to wear a mask. Your public health nurse will arrange a phone call with you at least monthly to discuss your client's treatment. You can also call the public health nurse anytime you have a question or concern. Just like your job is to support the client, the public health nurse's job is to support you throughout your service as a DOT aide. Now let's talk more about the TB medications you may be working with. Most people with active TB disease start by taking 4 different medications. These medications are really hard to pronounce, so we often refer to them by 3-letter acronyms. So, isoniazid is INH, rifampin is RIF, pyrazinamide is PZA, and ethambutol is EMB. You can learn more about these medications on page 39 of your DOT manual. If a client misses doses of medication, they could become contagious and spread TB to others. They could also develop drug resistance, where the TB germs become stronger than the medications. That is why DOT is so important. Your public health nurse will tell you what medications your client should take, and the medications and dosages will also be written on the DOT calendar. The medications come in dose packs or bottles that also tell you how much medication your client should take. The public health nurse will send the medication either by the airline or through the postal service. This is a medication dose pack. As you can see, it has the client's name, the medication strength, and the number of pills. So, this client will take 3 pills that are each 300 milligrams. That equals a total of 900 milligrams. Here is a line of 4 dose packs. That means that this client is taking 4 medications. The client needs to swallow all of the pills in these 4 packs. Some medications may come in a bottle like this. The label of the bottle will tell you how much medication the client should take. Now that we know more about TB medications, let's take a look at the part of our DOT visit where our DOT aide watches her client swallow the TB medication.
All right, Juanita. Now that we know that you're ready for the medications, let's start giving you the medications today. Here's the 3 pills of isoniazid. And 2 pills of rifampin. And 4 pills of pyrazinamide. It's okay to take your time. And 4 pills of ethambutol.
So many pills to take.
I know we can't save any for later. You have to take them all at one sitting. Since you have to take the medications twice per week, I'll be back on Thursday morning to give you medications. But before then, if you have any problems or if you have any side effects, please give me a call or the public health nurse. Okay.
Thank you.
Mm-hmm.
Now that you've seen a DOT visit, let's talk a little bit about safety. Your safety is the most important thing. You should never put yourself in a dangerous situation. If you feel unsafe in a situation, leave and contact your public health nurse. If you don't feel safe meeting a client at home, a different DOT location should be arranged. If you do meet a client at home, there are certain steps you can take to protect yourself. First, always let someone know where you are going. If possible, bring your cell phone with you. Be aware of your surroundings. Be aware of the exits and always position yourself close to an exit. And as always, leave the situation if you feel unsafe. TB medications can be hard on the liver, just like alcohol and street drugs. It's best for clients being treated for TB not to use alcohol and drugs, but we understand that this doesn't always happen. Clients with liver problems may have blood tests periodically to make sure that the TB medications or drinking aren't hurting their liver. The public health nurse will advise you if you need to stop DOT because of liver or other problems. If a client is drunk or high when you meet for DOT, always think about safety first. If you are worried and feel unsafe, leave and call the public health nurse. The public health nurse will help you come up with a plan for safe DOT. Options could include changing the DOT aid or trying DOT at a different location or time. It is also important to keep the client's TB medication in a safe location at your home. Medications should be stored at room temperature in a secure location away from children and pets. It would not be appropriate to store medications in the Arctic entry or a four-wheeler cargo box because they would get too cold. And it's not appropriate to store medications on the floor or a low shelf because children or pets could easily reach them. Another thing to remember is that medications should only be used for the client whose name is on the packaging. If you run out of medications for one client, never use the medication from another client. Always contact your public health nurse when you are low on medication. Now let's talk more about documenting the medications that you observe. This is the DOT calendar. Bring the calendar with you to every DOT visit. After you observe the dose, record the 3-letter acronym for the medication and the strength of the medication. The name and strength can be found on the medication dose pack or bottle. Let's look closer at this calendar. This section tells you what medications the client is prescribed. So, this patient should take isoniazid 900 mg and rifampin 600 mg 2 times per week on Monday and Thursday. Here is where the DOT aide documented the observation. They wrote INH 900 mg and RIF 600 mg and then added their initials. In this calendar, the DOT aide wrote a note that they were unable to locate the client, so the client missed a dose. As we see here, the DOT aide was able to locate the client the next day and observe the medication. That is the end of this video. Remember, there is a lot more information in the DOT manual. Thank you for being a DOT aide and keeping your community safe from TB.
Dag wat na ramkan